Hi guys, welcome back to my channel. My name is Anna. I'm a clinical psychology doctorate student and I make videos about real-world applications to psychology. Was that not the cutest thing you've ever seen? So in this video, I'm going to be tackling something that one of you made a comment on in one of my other videos, which is how do you know the difference between shyness and social anxiety disorder. So, to start off with, I want to say, in my opinion, and in the opinion of other professionals as well, any sort of pathology is on a spectrum. So you have, what's considered in the healthy range, then slight, mild maladaptive tendencies, moderate maladaptive tendencies, and then severe pathology. And it can be tricky to pinpoint exactly where someone on that spectrum is. But honestly, the label doesn't even matter so much as the treatment does. So if you're watching this and you're worried you might have social anxiety disorder, honestly, the label doesn't matter that much because the treatment is kind of the same, and we'll get into that. And even if you do see this and you think, okay, well, I guess I don't have this disorder, but I'm still in distress, just know that your distress matters and your suffering counts even if it doesn't meet clinically elevated threshold. So, all right, let's just start by looking at the criteria for social anxiety disorder based on the DSM-5, which is a book that psychologists use to diagnose people with mental disorders. Marked fear or anxiety about one or more social situations in which you are exposed to possible scrutiny by others. So something like meeting someone new, giving a presentation, sometimes even walking down the street can open you up to scrutiny from other people. And you fear that you might show anxiety symptoms that will cause you to be negatively evaluated. So you might feel embarrassed, rejected, someone might bully you for, noticing that you have anxiety. And this is interesting because it's not only that you're fearful of scrutiny, you're fearful of being outed as an anxious person. So, someone with social anxiety disorder, a lot of their anxiety is about not being labeled as someone with anxiety. Social situations almost always provoke fear or anxiety. So there's almost never a case when, if what you're worried about is giving presentations, there's almost never a case where you aren't panicked about a presentation. Social situations are avoided or endured with intense fear and anxiety. So avoidance is a huge component of pretty much any anxiety disorder. You don't want to feel that sense of dread and terror and anxiety, so you avoid anything that might cause it. The fear and anxiety is out of proportion to the actual threat. So, okay, let's say someone realizes that you are shy or socially anxious. How much is that really going to affect you? If we look at it objectively, sure, they might think that. Are they really going to treat you differently? Maybe a little, probably not. How much are you really going to interact with them anyway? The point is, it's not the end of the world, but for someone with anxiety, it feels like it. The fear, anxiety, or avoidance lasts over 6 months, and it causes clinically significant distress or impairment in areas of functioning. And then there's a specifier, which is basically like a subtype of the disorder, and it is performance fear, so especially impairing people in their professional lives or roles that require public speaking. So these people don't necessarily fear in non-performance scenarios, such as, talking to people one-on-one, but rather in ones where they have to perform or speak publicly. Now, I'm not a psychiatrist, I'm not a psychiatry student, but I know from, just anecdotal evidence that beta blockers can be extremely helpful for people with the performance fear specifier. And beta blockers for this purpose are usually very low doses of a medication used for high blood pressure. So what it does is just kind of take away the physiological components of your fear in that performance situation. So you're not going to be sweating as much, you're not going to be feeling your heart palpitate as much, you're not going to get your hands shaking, your voice shaking, things like that. And so definitely, if you do have this and you're open to medications, maybe try to seek out a psychiatrist, because that could be really nip it in the bud much faster than some of the talk therapies we're going to talk about. So, we should distinguish social anxiety disorder from schizoid personality disorder. They may outwardly look the same because both are presentations where people are not really interacting with people that much, kind of avoiding interaction with people. But there's a huge difference, which is that people with schizoid personality disorder don't really feel the need to interact with other people. They kind of don't care about other people's lives and they're okay being alone. Whereas people with social anxiety disorder, they care so much that they are anxious, and that's the reason they avoid these situations. And often shy or socially anxious people really crave that connection. They just don't know how to attain it. So the mean age of onset for social anxiety disorder is 13 years old. That's a pretty typical age for something like this to occur because of bullying going on, a lot of interpersonal conflict. Nothing is as interpersonally terrifying as middle school. But you know, as far as like onset of mental disorders go, this is a pretty early age of onset. You know, there are others that typically form around this age, but it's pretty early considering. The temperamental risk factors of developing social anxiety disorder are behavioral inhibition and fear of negative evaluation. And you know, these are arguably components of shyness as well. You're dealing with the same construct, just on a smaller scale. So behavioral inhibition is, let's say you want a second piece of cake. You know, you really want it, but you don't reach for it and you stop yourself with such ease because you don't want to be judged for it. And behavioral inhibition isn't just related to social situations. It could be you're on a diet and you really want that second piece of cake and you stop yourself from having it. And then fear of negative evaluation is another component, which is, you know, you just want people to like you. You want people to accept you. You don't want them to negatively judge you or evaluate you. So you might still be confused. Okay, well, do I have shyness or do I have social anxiety disorder? Only 12% of self-identified shy people actually meet the criteria for social anxiety disorder. And the key words here are clinically elevated stress and impairment in functioning. So how distressed do these symptoms make you feel? Do you avoid doing things that you love and that you need to do because you're so fearful of those situations? Are you afraid of going out in public, talking to people to the point where you don't even want to go to the supermarket, for example? You know, simple shyness would be feeling some discomfort about, say, going to the supermarket. But social anxiety would be, it is so debilitating that you refuse to go. Are you experiencing impairment in your schoolwork or your job? So are you not able to talk to your coworkers or your classmates? Do you refuse to do presentations? Are you not volunteering in class? Do you avoid social situations to a point where it negatively impacts your performance? And you know, how's your social life? Do you have friends? Do you feel comfortable going out places with them? Or do you barely have friends because you're so terrified of talking to people? Now, there's a possibility that you don't meet the criteria for social anxiety disorder now, but you know, you have some shyness that predisposes you to developing it later on. The more you avoid something that you're afraid of, the more that fear intensifies. Let's take, for example, speaking in class. You know, in the beginning of the school year, you know, you might feel a little shy about speaking in class. You might kind of avoid it, maybe raise your hand once or twice a week. And then as the semester goes by, you find that you want to speak less and less and less. You're like, no, it makes me anxious, I'm not going to do it. And now, by the end of the year, you are so fearful of speaking up in class that you physically almost can't do it. I mean, you can't force yourself because the fear has intensified so much. And exposure is your best friend in getting rid of a fear. It kind of demystifies it, you know, because your body realizes, I'm terrified of talking in class, but then you do it and you're like, oh, it wasn't that bad, maybe I can do this again. The more you expose yourself to the things you're afraid of, the more your fear goes down. So ideally you would be doing this in the format of therapy, which, you know, there's the CBT subtype of therapy that's used for social anxiety and other anxieties as well, and it's called systemic desensitization. It can also be called exposure therapy. They're slightly different, but, you know, forms of the same thing. You know, if you don't have a therapist with whom to do this with, which, you know, I recommend, that's your best bet, try to do these alone. So try to make a hierarchy of everything that makes you the most anxious, from the least, you know, something like going up to sharpen the pencil in class, to the most, which is, let's say, speaking in front of your class. And start at the bottom and gradually work your way up. You might say, okay, I'm gonna go sharpen the pencil every day of the week this week. And the next week you go up to the next one and you say, today I'm going to strike up conversation with a classmate I'm not super close with. And practice, 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 because the more you do it, the easier it's going to get and the less anxious you're going to feel. There is a caveat, which is that if you stop practicing, if you stop exposing yourself to this, you could be at risk of, you know, developing those fears all over again. So it is something that has to be a continuous process, a continuous effort. And look, I get it. It's not fair that you should live your whole life in fear of, you know, this fear coming back, but it's something that is not fair. It's just the way it has to be, because some of us have predispositions to be a certain way and we might have to work on that our whole lives. So those were my 2 cents on the difference between shyness and social anxiety disorder, and what you should do for both of them. Please hit like and subscribe if you like this sort of content, and comment down below where you see yourself on the spectrum if you feel comfortable. I will see you tomorrow because I've been posting every day of the quarantine and I'm gonna keep it going.